Hi guys, my name is Phoebe Shackelford, and in addition to being Clover's mom, I am also a pharmacist. So I wanted to take a few minutes today to talk to you about vaccines and COVID-19. Now, a vaccine is something that teaches your immune system to fight off infections. It can be in the form of a pill, a nasal spray, or more commonly an injection. And they can be used to help prevent things like polio, measles, the flu, and even chickenpox. Many different viruses and bacteria have vaccines. Now, when I was a kid, chickenpox was something that you just got, and for a week you were sick with an itchy red rash all over your body. People would even hold parties so that you could go catch chickenpox from your friends. But what we realize is that as you get older, that chickenpox virus never actually goes away. It just hides in your body until your immune system is weakened. And it takes that chance to come back as something even worse called shingles. You may have had parents or grandparents that have had shingles. So now as a kid, people are vaccinated against chickenpox so that they don't have to have that itchy red rash. And as they get older, they won't develop shingles. A vaccine gives your immune system the tools to recognize and react to a pathogen when it enters your body. It usually contains a weakened form of the germ and an active or dead or killed form of the germ, a specific part like a protein or a sugar, or a toxin that the germ produces that makes you sick. And by introducing a part of the bacteria or virus into your body, your immune system can start to build up its defenses against the pathogen without actually having the disease. So what is COVID-19? It's a type of virus called a coronavirus. It's named for all those little spike proteins around the outside that make it look kind of like a crown. There's 4 coronaviruses that are actually endemic in the population and cause the common cold. So very mild diseases. Now there's more dangerous coronaviruses that we've known about for a long time. One is called SARS, the other is MERS, and they've caused outbreaks in other countries. Scientists have been working for many years on vaccines to prevent SARS and MERS. So when COVID-19 started spreading in 2019 and 2020, scientists got to work at developing a vaccine for COVID-19. Once we realized that the pandemic was very serious, the government did step in, and they created what was called Operation Warp Speed. Operation Warp Speed provided coordinated strategies to speed up vaccine development without sacrificing safety or scientific standards. The FDA has very strict criteria that ensures that all vaccines are safe, and no step in the testing process was skipped, but rather stacked or sped up so that multiple steps in the clinical trial process could be completed more quickly or at one time. The original goal was to deliver 300 million doses by the 1st of January. Unfortunately, we did fall short of that. Currently, we've had about 40 million doses delivered to states across the country. We've given out about 19 million doses and about 400,000 just in Indiana alone. Because of the limited supply of vaccine, the government is carefully selecting who gets the vaccine first. They started with people who are most at risk of exposure to COVID-19, which is healthcare workers. They also included people who live or work in long-term care facilities like nursing homes, because this population is most at risk of having a severe disease if exposed to COVID-19. Currently in Indiana, if you're a healthcare worker, live in a nursing home, work in a nursing home, are a first responder like a policeman or a firefighter, or if you are 70 or older, you are eligible to get the vaccine. All the vaccines that have been approved to be used in the public were deemed safe and effective by the FDA. There's currently 2 vaccines available in the US. There's Moderna and Pfizer. And in December, the FDA granted them an emergency use authorization so that they could be used in the general public. Both require 2 doses for optimal immunity. It's very important that you get that second dose. Moderna's second dose is administered 28 days after the first dose, and Pfizer's second dose is administered 21 days after the first dose. Now, it doesn't matter if you get it after 28 or 21 days, as long as you get that second dose. Both vaccines are mRNA vaccines, so not like the vaccines that I was talking about previously. They actually contain genetic blueprints for the COVID-19 spike protein. Once you're injected with the vaccine, your immune system responds to that spot in your arm where you were given the injection because it senses that you had a small injury. It encounters that genetic blueprint that was injected, and it starts to learn how to make that spike protein and build up defenses against it so that if it encounters coronavirus in the future, it knows how to fight it off. It is important to note that the two vaccines that are approved are only approved for use in adults. The COVID vaccine is much like getting a flu shot. It's administered in your upper arm, and you can expect to have a sore arm or some mild swelling or redness where you get the shot. You might experience some headache, some fever and chills, or a little bit of fatigue. Personally, I just got my second dose, and I did have some headache and fatigue, but it's pretty mild all around. Side effects are usually worse after the second dose. Now, vaccines are one tool to prevent the spread of COVID-19, but we have to continue to use other prevention methods. We need to continue to social distance, wear masks, wash our hands often, and stay home when we're sick. Unfortunately, COVID-19 will probably be around for a very long time. But with the use of vaccines and other prevention methods, hopefully, it will eventually be more of just a nuisance like the flu or a cold, instead of a global pandemic. Now, hopefully this gives you a better understanding about the COVID-19 vaccine. If you guys do have any further questions, please feel free to pass those along to Mrs. Middleton.